This vaccine helps to maintain immunity against diphtheria, tetanus, and pertussis in both children and adults who have previously been vaccinated for these diseases. It can also be administered during the third trimester of pregnancy to prevent pertussis in the newborn. Vaccination is the most effective way to protect against these serious diseases. Vaccines stimulate the body to produce its own antibodies for protection. Booster doses are necessary to maintain immunity as antibody levels may decrease over time. Before receiving the Adacel Tdap vaccine, make sure to read all the information provided by your healthcare professional. If you have any questions, don't hesitate to ask them. The medication is administered through an injection into a muscle by a healthcare professional, usually in the upper arm. It is possible for this vaccine to be given at the same time as other vaccines, such as hepatitis B, using a separate needle and injection site. Common side effects of Adacel Tdap Vial may include pain, swelling, or redness at the injection site, headache, tiredness, body aches, nausea, diarrhea, fever, chills, vomiting, or sore/swollen joints. You can use acetaminophen or ibuprofen to reduce soreness. If any of these effects last or get worse, tell your healthcare professional promptly. Rarely, some people may experience symptoms such as fainting, dizziness, vision changes, or ringing in the ears just after getting a vaccine injection. Tell your healthcare professional right away if you have any of these symptoms. Sitting or lying down may help, since these symptoms usually don't last long. Remember, this medication has been prescribed because your healthcare professional has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your healthcare professional right away if you have any serious side effects, including high fever, higher than 104 degrees Fahrenheit per 40 degrees Celsius, seizures, numbness/tingling, muscle weakness, or difficulty breathing. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your healthcare professional. Before getting the Adacel Tdap Vial vaccine, make sure to tell your healthcare provider if you have any allergies. This vaccine may contain inactive ingredients that can cause allergic reactions. Talk to your healthcare provider about your medical history, especially if you have any nervous system disorders, current illness, immune system disorders, or if you are pregnant or breastfeeding. It's important to be aware of any potential interactions with other medications that may affect how Adacel Tdap Vial works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your healthcare professional. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this vaccine include drugs that weaken the immune system, such as cyclosporin, tacrolimus, cancer chemotherapy, and corticosteroids like prednisone, as well as other vaccines like diphtheria/tetanus toxoids. This medication is used to boost immunity against tetanus, diphtheria, and pertussis, whooping cough, in adults and children. It works by causing the body to produce its own protection, antibodies, against these diseases. Your healthcare professional will decide which vaccine is best for you based on your age, vaccination history, and previous reactions. It's important to discuss the risks and benefits with them. Even if you've had tetanus or diphtheria in the past, you may still need this vaccine as ordered by your healthcare professional. Make sure to keep track of when you receive the Adacel Tdap Vial vaccination so that you can stay on schedule for your medical records. Remember to store the Adacel Tdap Vial in the refrigerator and avoid freezing it. Keep all medications out of reach of children and pets. When it's expired or no longer needed, make sure to properly discard it. Check with your pharmacist or local waste disposal company for the best way to do this. And never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.